Presti here at Deep Blue Med Spa. I'm going to take you into my CoolSculpting room where we have our patient all set up and waiting. Come on in. This is Megan.
Hello.
This is my beautiful patient here. So Megan's actually all set to go. So CoolSculpting is the brand new #1 non-invasive device for fat reduction. It's amazing. It works really well on most patients. Megan here has a little problem area in the lower abdominal area that she says she works out all the time but has a really hard time getting rid of
here,
it.
yeah.
Yeah, so CoolSculpting is going to be key for her. What we're going to do is put the applicators this way and this way, which follows the orientation of the bulge, and we're going to be able to reduce this for her about 20 to 30%. So we're going to do the treatment, only takes about 35 minutes per cycle. She'll be very comfortable. She won't feel much of anything during the treatment, but a little cold. About 5 minutes in, she'll go numb and she can actually sleep or watch TV. So how the device works, it applies the cold to the area. Your fat cells, they don't like cold. They're going to go through a programmed cellular death, and over the course of 12 weeks, it's going to be eliminated through the body's natural elimination system. And she'll see results in about 4 weeks to 6 weeks, and at 12 weeks will be her final result. Most patients do this one time and they're really happy. Sometimes they might want to come back and treat again for even more of a reduction of fat. Now we could treat various areas. The abdominal area, the flank area happen to be the most popular for patients, but we do areas like the inner thigh. We can do the arms over here. We can do the little bra roll, the back, the flanks. We can even treat your double chin now. So all these areas can be treated very safely and effectively with CoolSculpting. So if you'd like to watch, we'll get our treatment started. Okay, come on, lay down here. Get nice and comfy. So we're going to start with the left side here. So we're just going to pull this down. We're going to be applying a gel pad, and the gel pad actually acts as the lubrication to draw the tissue up into the applicator, because it does use a little bit of suction, but it also keeps the skin safe during the treatment. So the temperatures really are almost like refrigeration temperatures. Your fat cells are so sensitive to these things, so they're going to be affected at a very safe temperature as to not affect any other organs, blood cells, skin. Everything stays intact and is really safe. So we're just going to get the system started here. This takes a second. Okay. So here's our lovely applicator. We're going to turn the suction on so you can hear it. And now if you want to come in close, we can see the tissue is just going to be drawn into the cup. 1, 2, 3, and that's it. Okay, so now we're going to turn the system on, and Megan will sit here for about 35 minutes, and you're a go. How do you feel?
I feel great. I can lay here for more than 35 minutes.
When do you get this downtime,
yeah,
right? So as soon as Megan's treatment is over, or her cycle is over, I'm going to come back in. We'll remove the applicator. We'll massage that tissue down. She might feel a little pinching during that time, but very comfortable. She'll go, she can, as soon as she's done with the next cycle, she'll get dressed and she'll go about her day. You can work out, you can do whatever you need to do. There's absolutely no restrictions. Drink plenty of water, obviously, but she'll be just fine and feel really comfortable. And in about 4 weeks, she'll start to notice her result. And at 6 weeks, we'll take your first photos, and then at 12 weeks, we'll take your second photos so we can see your progress.
Awesome.
Really great treatment, great for everybody. Most patients can be treated pretty quickly. There's no restrictions in the summertime. There's no reason that the skin can't have a little tan to it if you need to. So yeah, so that's CoolSculpting in a nutshell.